Okay. All right. Hi, everyone. I'm Hope Nemiroff, Executive Director of Breast Cancer Options, and welcome to Toxins and Breast Cancer and What We Can Do About It. I'd like to introduce first Sarah Carlson, who is the new addition to Breast Cancer Options staff. She'll be running the monthly Young Survivor Breast Cancer Support Group and handling outreach and marketing, and will help in writing grants, and she is a young survivor. Okay, I think we have some more that can't fit on the screen. I'd like to introduce Dr. Boham. Dr. Boham learned how difficult it can be to navigate through the healthcare system after being diagnosed with breast cancer at the age of 30. She realizes how important it is to evaluate all of the systems in the body to discover the underlying cause for dysfunction. Now, Dr. Boham is medical director at the UltraWellness Center in Lenox Mass, and she lectures on a variety of topics, including women's health and breast cancer, prevention, nutrition assessment, insulin resistance, weight control, and a host of other things. She is an educator for the Institute for Functional Medicine and developed the functional nutrition course used to educate physicians, healthcare professionals worldwide. So I'd like to introduce Dr. Elizabeth Boham.
Thank you, Hope. Can everybody hear me? Yeah, ready to go?
Ready to go.
Ready to go. Okay. Well, hi, everyone. Sometimes it's hard to tell if we're ready to go when we're on screen, isn't it? Is everybody here? Well, it's really great to be with you tonight. And we're going to talk about toxins and breast cancer, and then most importantly, what we can do about it over the next hour or so. I'm going to leave time for questions at the end. So, don't hesitate to reach out with questions. You can put them in the chat, and Sarah's going to sort of collate them, and then we can kind of go through some of them at the end if anybody has questions. So, toxins and breast cancer and what we can do about it, this is a big topic, and there's a lot for us to kind of go through. As Hope mentioned, I had breast cancer. I had a triple negative breast cancer when I was 30. So I'm almost at 24 years. I had, at the time, I had surgery and chemo and radiation. And I remember feeling so frustrated about all the epidemiological studies that were being done. I remember thinking about, well, if there's anybody collecting my data, right, they're looking at when I got diagnosed with breast cancer, where I was living then. So, you're always wondering, like, who's collecting all this information and how do they kind of figure out if there's cancer clusters or that sort of thing. And I had a lot of conversations with one of my oncologists along the way who was really interested in public health. But we were kind of talking about, well, at what point are you paying attention to that person's location, right? So are you looking at where did they live at diagnosis? But what's interesting about toxins and toxin exposure, and what we're going to talk about, what we realize is that there's this long latency potentially for a lot of toxins. So sometimes the toxins we were exposed to happened when we were in utero. That means when we were in our mom's womb, when we were a fetus, we might have been exposed to something. Or maybe when we were going through puberty. We also recognize that sometimes there's multiple hits throughout our lifetime that influence our risk of getting cancer. So what I find interesting about this topic is that we want to figure out, okay, what is my toxin exposure right now? And that's really important because we want to work on lowering our toxic load. But sometimes it may be something we had exposure to many, many, many years ago, or prior to us being even born. And they're also learning about some transgenerational impact that some toxins have had, unfortunately. So it's a very complex topic, but we're going to talk about what are some practical things we can all do to try to stay as healthy as we can. And so what Hope was mentioning is I practice functional medicine, which is a way of looking at underlying root cause as much as we possibly can. So we'll look at different imbalances in the body that can influence risk of disease. We don't just pay attention to the diagnosis, but we pay attention to that person's history, their story, so we can get a sense of how all their systems in the body are interrelated. And then if you take a person with cancer, there may be multiple reasons why that person got cancer, whether it was, people always talk about stress and having gone through a stressful event prior to, or insulin resistance or a lifestyle. But we also know toxins are a big impact. And definitely with all the patients that I'm working with, especially young patients who've had cancer, we definitely know toxins are something we need to really focus on and work on, not just lowering our toxic load, but also supporting our body and our body's ability to mobilize toxins. So that's what we're going to talk about for the next few minutes. Okay, so ideally, right, what we want to do is create this terrain in our body where cancer is less likely to grow, right? We know that we don't want to just pay attention to the cancer cell, but we want to pay attention to the soil, the terrain that those cells in our body are in contact with, because that terrain influences whether this cell can become cancerous and metastatic, or whether it's able to, the body can find it and get rid of it and take care of it, right? So the idea is we want to create this healthy terrain in our body, a terrain that's low in inflammation and a terrain that has cancer fighting capability, okay? I put this slide together a while ago, and there's many more dots we could put on the slide, but these are just some ideas of what things may create an unhealthy terrain in the body, right? Where cancer is more likely to grow, whether it's stress, right? We know the immune system doesn't work as well when we're under chronic stress. It's not like we can't handle small stresses or big stresses even, but it's that chronic stress without relief that's the issue. We're going to talk all about toxins today. We know that there are some unhealthy fats that we can, that can have an impact, or unhealthy foods. High sugar diet, insulin resistance, we know is a big driver for cancer growth. Inflammation. We know when there's inflammation in the body, inflammation in the terrain, cancer is more likely to grow. And of course, we know that about the connection between alcohol and breast cancer, unfortunately. But so we're going to be focusing on toxins tonight. And what we want to really highlight is the body has this tremendous ability to detoxify. We have all sorts of systems in the body that really help within the process of detoxification. So, here on the right, we know that we've got the lymphatic system, the liver, the digestive system, our skin. All of these things are involved in the process of detoxification. So when we talk about detoxification, what we really mean is it's the process of removing toxic substances and their negative effects on the body. Okay. So what matters? What matters in terms of toxins and how much toxins impact the health of our body? What matters in terms of if a toxin becomes carcinogenic or causes cancer cells to develop in the body, right? So, I've been thinking about this, like, what are the things that we need to really focus on? We need to think about exposure. We know that exposure to toxins, we want to do whatever we can to lower them. So we're going to talk about that. We need to talk about timing, because as we were mentioning earlier, that does have an influence. We know our genetics have an influence. And tonight I'm going to talk about some of the differences between these high penetrance genes, such as BRCA, right? And then some of the low penetrance genes that are very common and can influence risk as well, and what we can do about them. And then, of course, lifestyle. So that's how I'm going to divide up the next few minutes. So exposure matters. So what falls into this category of toxins? There are these endocrine disrupting chemicals. That just means chemicals in the environment that can impact the estrogen receptor in the body, right? Or any other hormone receptor for that matter. But those are endocrine disrupting chemicals. Those have included things like BPA, the plastics, parabens, phthalates. There's other toxins in the environment. from heavy metals like lead and mercury. Here I have cigarette smoke, medications. We know the charred broiled meats can change the meat in a way that can become more carcinogenic. And then we have to include things like the toxic food supply that can really have an impact on health as well. And the goal is we want to just work on lowering our toxic load, right? This can be a very overwhelming topic, and people feel like, oh my goodness, there's toxins everywhere. What's key to remember is we have the capability of detoxifying in our body, and we want to work on lowering our toxic load. That's key. Okay, so let's delve into these endocrine disrupting chemicals. These are exogenous chemicals, meaning they come from outside the body, or even mixtures of chemicals that can interfere with any aspect of the hormone action in the body. So whether that's the hormone binding to the receptor, the hormone doing its job, the hormone getting metabolized and gotten rid of in the body. And so they've also been described as xenoestrogens, or these chemicals that act as estrogens in the body, right? I think it was in 1987 at Tufts University, where they were doing some research on breast cancer. And they realized that the test tube, the compounds in the test tube were impacting their results. And so when they saw that the test tube was actually having an impact on the result, they were like, well, what's in these test tubes? And they realized there was these PVCs, or these polyvinyl chlorines, and as well as BPA, that were impacting the results of their breast cancer research. And so since then, there's been so much research in this area looking at everything from the BPA, the phthalates, the parabens, herbicides, pesticides, that can act as endocrine disruptors in the body. So some of the more common endocrine disruptors that we know about, and just so you guys know, if you don't, but Breast Cancer Options has a wonderful calendar. If you haven't seen it, in there's a beautiful section. It's like my favorite part of the calendar. I always, whenever I'm giving it out to patients, I'm always opening to that section. And it's a great part of the calendar where it has all this information about endocrine disrupting chemicals, other chemicals that can impact your risk of cancer, and what you can do to stay healthy. So I know you might not, I'm not sure if you're trying to take notes or taking pictures, but that's a really good resource for you to have. Okay, good information in there. So BPA, this is what I was talking about. We've known about this for a long time. It's that hard plastic that's found in hard plastic water bottles, those big water jugs that, where you'll get water out of, are often contain BPA, but also in things like dental sealants and the receipts. When you go buy something, you get a receipt, or from the gas station, there will be a coating on it that's BPA. Unfortunately, in some of our food packaging and inside cans. And the one thing I want to say about this is a lot of plastic water bottles will say, well, this is BPA free, but they've changed the chemical structure just ever so slightly. So yeah, it falls into that category of BPA free, but it still is probably not a healthy thing for us. So I'm really recommending trying to stay away from all plastic whenever possible. So phthalates, they are used as plastic softeners and solvents. You'll see phthalates are also found in a lot of fragrances. So in cleaning products and personal care products and some fragrances. So you'll see plastic food packaging, cling wrap, fabric softener, scented candles are places where you may find phthalates, also endocrine disrupting chemicals. The parabens are used as antimicrobial agents. And typically the most common place you'll find them is in your moisturizers, sunscreens, your makeup, but also in food supply. So unfortunately, like my husband went to pick up some tortillas the other day. We had some, but we had run out, and he went to like a local place just to pick them up quickly, right? Came home with some of the soft corn tortillas, And I was looking at the ingredients, blew me away because there were so many ingredients in them. But one of them was a paraben. And I was just like, I didn't realize how much these were found in our food supply as well. So you will, find them in tortillas or muffins or things like that as antimicrobial agents. So when you're looking at the label, you're looking to see, does it say propylparaben, isopropylparaben, methylparaben, butylparaben? Any of those are the ones you want to stay away from. And alcohol phenols found in detergents, air fresheners, fertilizers, herbicides, and the triclosan. And these are antimicrobials in liquid hand soap, also some whitening toothpaste. Unfortunately, they've been trying to get these out of the toothpaste as well, and some of the antimicrobial hand soaps, because they act as endocrine disruptors. Okay. So as I mentioned earlier, exposure matters, but so does timing. And this research is kind of interesting. And I know there's a lot of information on this page, but what I wanted to highlight is there can be this long latency between exposure and diagnosis, meaning that they've done studies to show that even prenatal or neonatal exposure to BPA can have an impact on our breast tissue, which can impact the likelihood of us developing breast cancer later in life. So, we want to do the best we can, but unfortunately, sometimes this exposure was a long time ago. DES, we think it's possible that my mother took DES with me and one of my brothers who subsequently got testicular cancer multiple times, and not with my older brother. But some of the research here is very interesting in terms of how it impacts risk of breast cancer in the offspring and maybe now even in granddaughters of the person who took DES. Unfortunately, DDT, they found that women who had higher levels of DDT in their blood samples postpartum had a much higher risk of breast cancer in their daughters when they got older. And of course, we know about radiation, right? Radiation exposure does impact our risk for future cancers, unfortunately, as well. So, but here showing that, exposure when you were in adolescence or childhood. So, sometimes that exposure happened when we were very young, or when we were going through puberty, that impacted our breast tissue, that then impacted our risk later on in life for developing a breast cancer. Genetics matter. We were talking earlier about different types of genes. So this is just a way to think about it that I think is very interesting, right? There are high penetrance genes and low penetrance genes, right? And there's probably a lot more in terms of how we can organize this in the future as we learn more in this area. But think of the BRCA gene, BRCA1 and 2, and things like CHEK2. Those genes fall into the category of high penetrance genes. What that means is they're not very common, but if somebody has a variation, it really impacts risk, right? So, they'll say here anywhere to if you do have a BRCA variation, it increases risk of getting breast cancer to 50% by the age of 70, for example, right? And it's about 1 in 500. In the US, it's about 1 in 400. If you're Ashkenazi, 1 in 40 have the BRCA variation. And somewhere in this risk of, 45 to 65% risk of getting breast cancer versus 7% risk without the BRCA variation. So that's considered a high penetrance gene, not as common, but when somebody has it, it does significantly impact risk. And then there's these low penetrance genes, which I think are also very fascinating and something we're looking at all the time. But these are genes where they're very, very common. Lots of people have it. I'll give you some examples in a second, but it may be even 30% of the population, very common. But they're looking at some combinations of these low penetrance genes and how they impact a woman's risk. So just because when you do your genetic testing and you test negative for BRCA and CHEK2 and all of those genes, it doesn't necessarily mean there's not a genetic impact, if that makes sense. And so they're looking at combinations of these low penetrance genes and that they do impact risk of everything from heart disease to obesity to cancer and lots of things we're looking at. But what we do also know about these genes is that we can impact the expression of these genes with our lifestyle. So that, and that's probably even, that's true of the high penetrance genes too, we think, but definitely these low penetrance genes, we can have an impact in terms of our lifestyle can impact how these genes express themselves. And so, which I think is good to know. Okay, so this study was looking at a combination of these low penetrance genes. They looked at GSTM1, these are genes that are involved in the utilization of glutathione in the body, the GSTM1 and GSTT1. And then COMT gene is involved in breakdown of estrogen, and it's involved in the breakdown of adrenaline, okay? So what they found was that when women have multiple variations in this area, so they have all three of these genes, for example, and that increases their risk of getting breast cancer. In addition, if they also have some of these other risk factors for breast cancer that we know about, BMI over a certain being over a certain BMI or body mass index, not having had children or having them late in life. Well, they're saying late in life over 25, right? Those things also impact risk. So when you bring things all together, that can have an impact on somebody's risk as well. COMT gene is a really fascinating gene. We look at it all the time. You can also get this gene tested if you've done 23andMe, and then you can have it analyzed, your information analyzed through a few different websites. The one I often use is called Genetic Genie, GeneticGenie. I think I did it, Genetic Genie. And Pure Encapsulations also has a genetic evaluation site, but you take your 23andMe data and you put it into these websites and they give you some of this information. So COMT has been a gene that's been really looked at a lot. It's very common. You'll see here 20 to 30% of the Caucasian population are homozygous. What that means is they got a variation from their mother and father. So they have a variation in both alleles, and that has the biggest impact. So even the most high impact COMT variation is very common at 20 to 30% of the population. But what it does is it decreases the effectiveness of this enzyme, this catechol methyltransferase enzyme, right? But what we see as a result of that is women or men for that matter, but will have a higher amount of dopamine in their body. And they also don't break down estrogen as well. So this gene is involved in the breakdown of dopamine. It's also involved in the breakdown of estrogen. So a lot of times women will struggle with things like anxiety. They may notice that, somebody else has the same stressful event that happens in their life, and they don't get left with as much anxiety as they do, more worry. But on the good side, because of the higher dopamine, they really can focus better. They're often better in school, or they get higher grades for whatever that means. They can focus better, but they can have more worry. We also see things like increased risk of fibromyalgia or body pain, signs of estrogen dominance, which could be breast cancer, also could be fibroid production, or things that come along when estrogen is high, like uterine cancer as well. So it's a fascinating gene. We work to support it with things like methylated B vitamins, magnesium, for some people, even SAMe. We also know the cruciferous vegetables, broccoli, cauliflower, cabbage, kale, really focusing on managing stress and putting a lot of energy in that area, good self-care, rest, and avoiding things that stimulate that sympathetic nervous system, which, for people who have this variation, just have a harder time with recovering after stressful events, okay? So this is one of the glutathione S-transferase enzymes, which are involved in the utilization of glutathione and are important for detoxification in the body, phase 2 detoxification, and the elimination of carcinogens from the body. This is another gene that is a high prevalence, meaning lots of people have it, but a low penetrance, right? A low impact. Lots of people have it here. You'll see here anywhere from 23 to 35% of people in Africa, somewhere in the 30s to 60s of Caucasians. It's a very common variation, but it is associated with this increased risk of cancer. And we do know one of the reasons why we're often recommending green tea is because it helps this enzyme work better. Okay. We also know that there are multiple different enzymes that are involved in the utilization of glutathione. So sometimes when one is a variant and not working as well, if we help support another one that can help with production of glutathione and utilization of glutathione even better. And this is where those cruciferous vegetables come into play. And we're going to talk more about that later. But there's this compound in cruciferous vegetables called sulforaphane, which can help with increasing glutathione production and help with people that have this higher risk. Okay, so that just brings us to lifestyle. Wait, did we do everything? We did exposure, we did timing, we did genetics. So now we're going to talk about lifestyle. So yes, lifestyle totally matters, doesn't it? Of course it does. And so I didn't realize this slide came up so quickly. So here's a picture of my broccoli sprouts that I made. It's actually really fun to make. You guys can tell me when we're at the end about your experience with making broccoli sprouts, if you have or you haven't, but they're fun to make and grow on your own. And the broccoli and broccoli sprouts, as well as all other cruciferous vegetables, they contain these substances called glucosinolates. These glucosinolates are phytonutrients. They are components in our plant foods that are really good for us, right? They're not vitamins or minerals, they're phytonutrients. And they have a lot of good healthy properties in them. Glucosinolates is one of them. And so our cruciferous vegetables are really high in these glucosinolates. It's actually what gives them that bitter taste, is these glucosinolates. And in the digestive system, these glucosinolates mix with something called maracinase, and which also may come from the cruciferous vegetables or maybe in the gut, but that then turns them into what's called sulforaphane. Sulforaphane has a lot of wonderful activities in the body, from its pro-apoptotic, which just means it can help the body get rid of abnormal cells when it needs to. It supports the metabolism of estrogen and detoxification in general. The sulforaphane supports the production of glutathione in the body. And it's also been shown to lower oxidative stress. And it also has been shown to feed the good bacteria in the gut. And as remember, I was telling you about how we can impact genetic expression. So this is an area where these sulforaphane can epigenetically improve these increased tumor suppressor gene function, which is good because that suppresses tumor growth, right? So sulforaphane and that comes from glucosinolates is really powerful. And, we're always recommending as much cruciferous vegetables as possible. What's fascinating about broccoli sprouts is that they have so much more of these amazing compounds than broccoli itself. So when it's in its young form as these broccoli sprouts, they're really, really high in what ends up being produced as sulforaphane. So it's a great thing to add in, 1 to 2 cups a week or every day if you can, right? And there are some people who are like, you know what, I also want to maybe just take some sulforaphane. And there are great supplements out there that have a combination of these glucosinolates with maracinase, which end up being produced as sulforaphane in the body. Fascinating, I added this slide in because of the connection between the glutathione levels in the body and our immune system. And they studied this a lot during COVID. And they saw that when people had higher levels of glutathione, their risk or their amount of COVID or the severity of COVID they had was less. So we want to work to boost up our glutathione. Glutathione is, think of it as just this master antioxidant and detoxifier in the body. It has a lot of tremendous things that it can do, from helping detoxification, but it's also been found to be important for the immune system. And when glutathione levels are low, people are more likely to get sick, colds, flus, COVID, cancer. Okay. So we want to think about what can we do to boost our glutathione production. And we know that when we increase glutathione production, it helps with making more natural killer cell activity. Natural killer cells are those cells that go around in the body and find abnormal cancer cells and gobbles them up. Okay. Or even an abnormal virus, or that, for that matter. So more glutathione has been associated with a lower risk of infection, better functioning immune system. It can help block that huge cytokine storm that we talked so much about with COVID. And so that's what some of this research showed. So, you know, it's interesting to note that spinach, okra, and avocado actually have, you know, they're rich in glutathione themselves. Cruciferous vegetables, as we just spoke about, boost the production of glutathione. The allium vegetables, that's like garlic, onions, shallots, also boost production. And selenium is a mineral that's a cofactor for production of glutathione. So selenium, you know, Brazil nuts are really always known for being rich in selenium, but you really only need 1 or 2 a day. You know, you can get too much selenium. Actually, it's probably one of those supplements, like when people are taking tons of supplements, we do sometimes see selenium levels go too high, because there may be a little selenium in here and a little selenium in here and a little selenium in here. You have to be a little careful. It's one of those minerals you can get too much of, from, especially from supplements or eating tons of Brazil nuts or putting them in your smoothie, that sort of thing. But you also want to have sufficient selenium, and that's really important because it helps the body produce glutathione. And the other thing that's necessary is glutathione is made from amino acids, right? Amino acids are these building blocks of protein. So you need amino acids, you need enough protein, which is going to make your amino acids, which is going to help the body detoxify. And sometimes we do see when people are limiting food intake for whatever reason, and they're not getting sufficient protein, we can see some issues with not having adequate detoxification. So things that make glutathione include cysteine. So you've heard about NAC, or N-acetylcysteine, glycine, and glutamine. Those are these amino acids that the body uses to make glutathione. As I was mentioning about green tea, and Hope always wants me to remember, we've got to remind you that it has to be organic. It's very important that your green tea that you're getting most of the time is organic, because it can be really working against you if it's not. But it's rich in EGCG, which is epigallocatechin-3 gallate. And a lot of studies kind of come to 225 milligrams of EGCG a day, or what may come from about 2 to 4 cups of green tea in a day. But it has a lot of really interesting properties, from anti-angiogenic, antioxidant, anti-inflammatory, can improve tumor suppressor gene and glutathione enzyme, increasing glutathione production, and also has been associated with improvement in metabolism, insulin sensitivity, and decreasing weight gain, or helping with weight loss. So it's a fascinating phytonutrient that a lot of people are taking. I love how this picture shows us the green tea both as the powder, like matcha powder, as well as the green tea leaves. And I'm often encouraging people to get the loose teas, the organic loose teas, because then you don't have to even think about the tea bag. And there's all sorts of things we can talk about the tea bag, but one of the things that I'm most concerned about are those microplastics in those very structured tea bags that they're using now, unfortunately, thinking that they're more fancy. Right. So I get concerned about that. I'd rather a paper tea bag, but I think what's most ideal is to get a metal strainer and just brew your own tea, most of the time. I was like, where's the slide? Here it is. So as we were mentioning earlier, phytonutrients are these components from our plant foods. They're not vitamins, they're not minerals, they're components from the plant foods that have this amazing health benefit for humans. So they're in plants because they defend the plants. They're in the plants to help the plant defend against microbes from the environment. So that's a great thing. But they've also been found to improve our defense against carcinogens. So phytonutrients have a lot of anti-carcinogenic potential in them. And so phytonutrients are in all of our plant foods. There's a lot of research to say that organic probably has more phytonutrient content and more mineral content. The plants produce these phytonutrients to defend against microbes in the environment. So if the plant is under more stress when it's growing, it actually produces more phytonutrients. This is a great study. I think it's fascinating. I think they did a really good job, and they allow us to show the diagrams from their research. So it's fascinating. And here they're talking about plastics and how damaging plastics can be from our body. And what you see here on the red side of this body here is all of the negative things that these plastics can do to the body. They can be neurotoxin, they can be immunotoxin, right? Which means they damage the functioning of the immune system. They can be hepatotoxic, damage the function of our liver. Nephrotoxic, damage the function of our kidneys. Gonadotoxic, damage the function of our hormone producing gonads. Genotoxic and carcinogenic. So plastics have all this negative ability for in terms of the health of our body. But what they're showing here on the green side of the body is all of the things that these polyphenols, right? Which polyphenols are phytonutrients. These are components. Think of them as the same. They're these components in our plant foods that have this tremendous ability to help improve our health. So they're showing that the polyphenols can be neuroprotective. They can reverse the immunosuppressive effects from plastics. They can reduce the level of DNA damage and reduce the carcinogenic effect. So really fascinating. So this study highlighted how toxic substances from plastics, really, unfortunately, they're everywhere. They can cause oxidative stress in the body, inflammation. They can promote cancer growth and metastases. But what's wonderful is these polyphenols from plant foods can actually have a protective effect against multiple different toxins from the environment. So these are like PCBs and BPA, phthalates and dioxins they've studied. I'm going to show you a cool diagram in a second. But so they can inhibit, which means that they've actually shown they can inhibit cancer progression and metastases that plastic compounds could promote. So here you'll see here, here's a normal cell and how a BPA can cause inflammation and oxidative stress, right? And cell death. But they're showing here that these polyphenols can actually block the effect of the BPA. And same thing here, or even in a cancer cell, right? That BPA could cause increased, here they're showing increased proliferation, but these polyphenols can block the effect of the BPA, right? So really our foods can be pretty powerful in this area. So we want to be thinking color, right? We want to be thinking color because our polyphenols or our phytonutrients are coming from our plant foods. And unfortunately, in the US, we're seeing a lot of deficiency here. So what this slide shows here is that 8 out of 10 Americans aren't getting enough color. When 74% aren't getting enough red plant foods, or purple or blue, or 69% not getting enough green plant foods, white and tan and yellow and orange. And so you really want to say, okay, I need to eat from the rainbow every day. I want to eat something that's red, and orange and yellow and green and blue, purple, as well as white and tan, right? And that doesn't include things with food coloring that give it that color, right? These are naturally colorful foods. And you want to really be thinking about, okay, what did I eat every day that from every color of the rainbow? Because that's a great way to ensure that you're getting enough of these phytonutrients, because we're learning all the time about all these different phytonutrients in foods, everything from chlorophyll that's in green vegetables and the glucosinolates we were just talking about, the xanthophylls in your it's like a carotenoid in like your carrots or your yellow peppers, polyphenols like quercetin and flavonoids and EGCG and other flavonoids that are found in our berries like anthocyanins. So there's lots and lots of these phytonutrients, lots and lots and lots. So what you want to try to do is get, here it says 8 to 10 1/2 cups in a day. So that's really vegetables and fruits. But when we're talking about phytonutrients in total, I really have people try to reach more toward 8 to 12 servings a day, because that also includes our spices, because spices are really rich in these phytonutrients. So they have so many beneficial effects, everything from turmeric to cayenne, but all your peppers, all your spices, oregano, all of these things, as well as our teas and our coffees, if they're organic, right? So you want to get something from every color every day, and really 8 to 12. And people always say to me, well, what's a serving size? And so in all reality, it depends on the food. If it's a spice, like it might be, a 1/2 teaspoon, right? Or even less, that might be a serving size. If it's a tea, it may be, a tablespoon that you're making your tea out of. But if it's green leafy vegetables that aren't cooked, it may be a cup. Or if you take spinach that's cooked, it may, officially it's more like it's a 1/2 cup, but it might even be less, like 1/3 of a cup, right? So it really depends on the food, what's considered a serving size, but really just trying to say, okay, am I getting everything from every color of the rainbow every day? It's also important to recognize that we have this tremendous ability to detoxify, as I mentioned at the beginning, right? I love how my little woman here has red hair. And so remembering we have all these systems in our body that are made to handle the toxins we're exposed to from our skin. We release toxins through our skin, through our lungs, our lymphatic system, through our colon and our stool. Our liver is supportive and our kidneys are supportive. So here's somebody who's releasing toxins through her sweat, and through her skin, right? Through exercise, sauna use, maybe we're embracing that hot flash, right? That's a way that we're helping the body release toxins. Through the breath work we're doing, right? Through the meditation, the breath work, the yoga, we release toxins through the lungs. Lymphatic work, right? Massage. Exercise actually helps with lymphatic movement and detoxification, detox baths, dry brushing. A lot of people will take Epsom salts and lavender and make just put it in a bathtub, and that's a great support for the lymphatic detoxification system. And sauna use, saunas can, as long as we don't overdo them, they can be a great way to support sweating and detoxification that a lot of us need. Here I got this, a few years ago from Mind Body Green, and it just kind of goes over how you dry brush. So if you want to look it up yourself, it's Mind Body Green, and it's kind of a step-by-step guide to dry brushing. But dry brushing is another way that you can help with lymphatic flow through the body, and that is helpful from a detoxification perspective. Colon, we release a lot of toxins through our intestines and out through our stool. So we want to make sure we have a diet that's really rich in fiber, because those fibers bind to the toxins in the gut, and then they get released in the stool. So you're really focusing again on lots and lots of plant foods, vegetables, lots of water, making sure you're having regular elimination and good healthy microbiome. Fiber is our friend, really. Fiber. It really helps with balancing blood sugar, but it really does also help with the elimination of toxins. And so fiber-rich foods include your vegetables, your fruits, ground flaxseed, I love, nuts and seeds, beans and legumes, and these fiber-rich foods feed the microbiome. What do we know about flax, for example? So both flax and soy can fall into this category of phytoestrogens. These are plant foods that actually have an impact on the estrogen receptor. So there was a time where people got concerned about that. They're like, oh no, maybe these are bad. But really all the research has shown that actually they have very weak impact on the estrogen receptor and prevent our own estrogen or some of these xenoestrogens possibly from binding to that receptor. So in reality, healthy forms of soy and flax actually lower women's risk because of their phytoestrogenic effect. So lignans are these components in a lot of our plant foods. Flax is really high in these lignans that actually can, that may have a risk reduction impact, especially in our postmenopausal women. But the nice thing about flax is it's also rich in omega-3 fats, which are these anti-inflammatory fats. So it's a really great thing to have. I always recommend that women get whole flax seeds whenever they can, keep them in the freezer, grind enough, like in a coffee grinder, that you might use in a week or two. Keep that in your fridge. And then you can sprinkle that ground flax seed. You can put it in shakes. You can put it in, in your yogurt or non-dairy yogurts. You can put it in on a soup or a salad. It's really a great way to get a lot of fiber, to get and to get this anti aromatase impact that it has, and also to help the body with detoxification, and also get your omega-3 fats. So really a great food. We know that healthy forms of soy have also this anti-estrogen-like effect in the body. They contain these isoflavones like genistein and diazine that can get converted into equal, which has a lot of health benefits in the body. And really, this Shanghai breast cancer study that came out in 2009 put a lot of people's concerns at rest. They found that women really, whether they had an ER positive or an ER negative breast cancer, if they were on tamoxifen or not on tamoxifen or a aromatase inhibitor, they had a lower risk of recurrence when they had a higher soy diet. What I do always recommend, is you want to get the organic non-GMO soy. I like, things like edamame that I just showed you a picture of, maybe some tofu, whole food sources of soy. I definitely stay away from soy protein powders, soy protein isolates, because that are found in like cereals and bars. I'm not a big fan of those because that's not as well studied. But whole forms of soy, I don't think we need to be worried about at all. Liver, we also detoxify. The liver is really important to support detoxification. We want to do whatever we can to protect the liver. So we want to lower our toxic load. We want to make sure we're getting adequate protein that helps the liver do its job. We want to watch our alcohol intake. And as we know, unfortunately, breast cancer survivors, we want to be really low in our alcohol intake, and we want a really nutrient-rich diet. So, just to review, lots of water, fluids, hydration, fiber, adequate protein. And I keep bringing that up about protein because it is important to support detoxification. And I typically recommend, getting animal and vegetable protein. For most people, that balance is really good. But either way, you just want to get sufficient protein, and lots of cruciferous vegetables and these phytonutrients in your plant foods. So in general, like for foods that support detoxification, You can focus here on the left-hand side, the whole foods, your greens, broccoli sprouts, beans and legumes, nuts and seeds, you know, colorful vegetables, spices. And avoid, you don't want to use up your calories on junk food, right? Because what junk food means, it's food that has a lot of calories in it, but not a lot of nutrient level. You know, it's not rich in nutrients, but high in calories. So you don't want to waste the calories that you are going to eat on those foods that aren't going to give your body what it needs to do all of these processes that it's doing, including detoxification, right? They're just empty calories. And the kidneys, finally, making sure you're getting adequate hydration. Maybe consider, let's read. She is using glass. I'm going to see, yep, that is definitely glass. So making sure you're having regular bowel movements, lots of water per day, sweating. This woman is sweating here, exercise, sauna use, steam baths, yoga, lymphatic massage, all supportive. So what can we do? Right? We want to go organic. That's especially important for your spices, your teas, but your vegetables as much as possible. It will help lower your pesticide exposure when you're going grass-fed, grass-finished, for example, for red meat. That's going to also lower your growth hormone exposure. And so, going more organic for all foods as much as possible. Always using glass, storing, glass for water bottles or stainless steel, glass for storing your food. Definitely don't heat in plastic. Limiting packaged foods and processed foods, because the more foods we buy that are already prepared and packaged and processed, we're just going to get more of these, the packaging, right? Which may include some of this plastic wrap or other things that can be toxic to the body. Switching to glass or stainless steel. Definitely read labels on your personal care products. Switching to unscented things like lotions, laundry detergents, cleaning supplies, go unscented, avoid herbicides and pesticides. And then these are some, good resources, the environmental working group. So you can look up you can look up some products, as well as Think Dirty. And as I mentioned earlier, the breast cancer options calendar, which is wonderful. And we want to work to create this healthy terrain where cancer is less likely to grow, right? With our group support, as we're doing tonight, with our daily movement and exercise, rest, all these phytonutrients, fiber, omega-3 fats. And, I have here just a couple of discount codes. If you guys haven't seen my DVD, there is still some DVDs available, and you can use this discount code, but you can also just reach out to me. I'm happy to send you a DVD for free, because there's not going to be a lot of DVD players very soon. I'm running low in stock, so I have to figure out what I'm going to do next, how I'm going to put something together for people to have access to. I'm going to have to probably redo something here, which is time. And then, or you can use this code for Vimeo. You can watch it instantly on Vimeo. And if you want to follow me, drboham.com, ultrawellnesscenter.com, Elizabeth Boham, MD on Facebook and Instagram, and at Dr. Boham on Twitter. But I think I did pretty good in terms of the timing. We have some time for questions, so I'm going to stop sharing, and then we can discuss any questions you guys have. Does that sound good?
That sounds great. Thank you so much, Liz. That was incredible.
Okay.
I've been looking through the chat and getting some questions here, and so I'll just kind of start going through them. The first one from Anna Martin is, can you speak about dietary oxalates and whether they can cause microcalcifications that lead to breast cancer?
So not that I know of. So dietary oxalates, I think that I don't have a big concern over dietary oxalates in general. I think that we do produce oxalates in the body. It seems to be related to our microbiome even more than our dietary intake. So it's not a big concern that I have.
Great. And this is one for me. I was just wondering if you could walk us through in a general way the actual impact that endocrine disruptors have on the body. And I know that that's a big kind of complicated question, but it just, can get kind of abstract when we hear endocrine disruptors over and over again. And just getting a sense of like what actually happens to the body when we're encountering these chemicals, if that's possible.
Yeah.
In a brief way. I know that's probably difficult.
So, that's a great question. So, with a lot of areas that we could go down, but there's been some research looking at these endocrine disrupting chemicals impact. So they can impact all aspects of the hormones in our body. They can impact and stimulate the estrogen receptor or other receptors in the body. They can actually impact, we think, genetic expression in the body. And, from some of the research I've been doing, it's showing that we can, that endocrine disruptors have had an impact on everything from fertility, right, to insulin resistance, to weight gain, to which can impact hormone balance in the body. And so remember that one slide I showed about endocrine disruptors and how they can have an impact on increasing inflammation in the body. They can increase oxidative stress. And we do know that cancer likes to grow in the face of inflammation and oxidative stress. They've also been shown to have carcinogenic potential. So I think that there's a wide range of impact, and I don't think we have it. I mean, I think we'd have to go through each one specifically, which I don't know if I have all that information on the top of my head, but it's unfortunately widespread. And what I was reading more about BPA, right? Like, for example, they're showing that even low levels of BPA can cause changes in our breast tissue. So if we have low levels when we're a fetus, for example, that can cause changes to our breast tissue that then can make the breast tissue more at risk for developing cancer cells 40 years later. So it's there's a wide range of areas that where it can have an impact.
Got it. Thank you. Here's one from Jennifer Randall, and she's saying, I'm confused about glutathione. It sounds like those of us with the GSTM1 null gene have too much glutathione, so we wouldn't want to eat more, right? So that's her question, and maybe you could clarify.
Yeah, no, if you are a GSTM1 null gene, you don't utilize your glutathione well. So it's not that you don't have too much, you're just not recycling or utilizing it well. So actually people typically need more glutathione support in terms of production.
Okay.
I'd like to add something about the green tea that you were talking about. On our website is a study about DDT in green tea from China, which was a study of me. I was working on a study. I was lucky enough to be able to be tested before and after. I don't eat anything or wear anything anymore that comes from China because they still spray a lot of things with DDT. We tested the tea that I bought. It was Alvita green tea from the health food store, and it was full of DDT. Yes, it wasn't organic, but you have to really be careful. anybody can go on our website and read that study if you want to. And if you want a copy of the calendar, I'd be more than happy to send it to you.
I really like, I've been getting See-Me tea. I think you spell it Seemei. I think that's how you spell it. It is green tea grown in the US. I think it's grown in California. I'm almost positive it's organic. They do matcha, they do decaffeinated sencha, they decaffeinate with a water processing, so it's not chemically decaffeinated. And you know, it's a really nice company that I found.
Also, the way I detoxified from the green tea, because they tested my levels before and after, was sitting in a sauna 5 hours a day for 20 days until the levels went down.
Yeah.
I mean, I wouldn't recommend somebody just doing it, and unless you have a doctor who is going to test you before and after. You know, that's,
You know, and I've been struggling with testing. I've really been having a hard time finding companies that I really trust and I'm feeling comfortable with in terms of toxin testing. I think it's a very tricky area, and I don't feel like we have good companies as of, you know, in research they are, but like, you know, clinically, what can we use for testing? I'm struggling with that as a clinician. So we will look at oxidative stress markers, detoxification capacity. We'll look at GGT. GGT is a blood test that everybody can get done. You can ask your physician to do. GGT is a sort of an indirect marker of glutathione in the body. And ideally, like there's a range for GGT. It's a liver function test that you can ask your doctor to do. And it might be like 0 to 65 is considered normal. But ideally, we want to keep it in that the lowest quartile, which means like 16 or below is ideal. And when it's going higher, there are signs that there's been more exposure to toxins and more exposure to or an increased glutathione demand, meaning that you have a higher toxin exposure. And we have been testing for glyphosate, you know, but this is the part where I find it frustrating as well, because as we were mentioning earlier, there are all of the impacts in terms of the chemicals and toxins and how they have shifted our breast cells in our body, so that it might not even be current exposure that is the risk, right?
Yeah, that's really wild. So we have another question, which is, can you give recommendations regarding diet and supplements for preteen and teen girls?
Okay, so the question was diet and supplements for preteen and teen girls. So, I mean, I think that when we're talking to our kids about diet, especially at that age, we just want to make good recommendations for, you know, healthy diet and explain why. But we also have to be a little careful, because sometimes if we push too hard, it can backfire. So you just want to be, you know, conscious of that when you're working with that preteen, teenage young lady, that you know, we can push too hard and that can really go in the wrong direction. So, but you want to talk about what's really healthy. And so what I always talk about with diet is, you know, first and foremost, balancing blood sugar. So at each meal, you want to have a good source of protein, fat, and fiber. Those protein, fat, and fibers help slow the digestion and absorption of your food. They help prevent spikes in blood sugar and spikes in insulin. And we know that blood sugar and insulin spikes are the key to, you know, that those spikes in blood sugar and insulin feed cancer growth, right? So we don't want to do that. It's very pro-inflammatory. So at every meal, you want to have a good source of protein, good source of fat, good source of fiber, and that will slow the digestion. And so I really help our young adults really figure out how they can balance their meals so they have that better blood sugar response. Then you really talk about the benefit of vegetables, right? And why you want to be choosing more plant foods in your diet. You know, how we like spices. Get your preteen and teens in the kitchen, you know, encourage them to get involved in cooking and food preparation. It makes a big difference, because when we're preparing our own food, we have so much more control and we get so much, you know, better food outcome than packaged foods. So I guess that's where I would really focus. Supplementation, I do supplement, you know, I recommend it, you know, often for people, but remember, supplements are supplemental, right? They shouldn't be our number one focus. But I would say that if I was going to pick a supplement, the things we see the people are the most deficient in are omega-3 fats. So some sort of fish oil, sometimes vitamin D, especially in the winter months and where we are. And then maybe, I mean, that's kind of what I focus on. You know, then you could get in the whole category of multivitamin, and then that's a whole nother story. If you are going to use a multivitamin, do one that has methylated B vitamins in it, a better quality one that's got like methylfolate in it, not folate.
Is that because of MTHFR?
Partly because of MTHFR. There may be other things, but folic acid has had some, you know, concerning research in terms of cancer, and maybe because of MTHFR that people can't utilize that folic acid. But if you look on your vitamin supplement, multivitamin or B complex, and it says folic acid, look for one that has instead methylfolate. It's usually a better quality, better utilized in the body, and that's, I think, a better way to go for most people.
That was my question. If you don't mind me asking, what about dairy? I mean, that's a hard one to get somebody to give up get a kid to give up their ice cream and their chocolate milk and all that stuff. So how important is that?
I think the answer is we do not know, right?
Okay.
Right. So here's the thing with dairy, and it probably depends on the person, and it depends on the amount. But dairy, it falls into that category of there are some good things and then not good things about it, right? So in the concerning things about dairy, it's a high hormone food. So for us to get milk from cows or sheep or whatever, though they've got a lot of hormones floating around. They have to be in a state of high hormone to produce that milk. So that for some people, they're very sensitive to those growth hormones. And so I do have some concern around that, around lots and lots of dairy. So if you are doing dairy, I say you want to go organic, definitely, for dairy, because you won't get that extra antibiotic or growth hormone that's added to some. Okay, so go organic. The positives, or sorry, let's see, the other negatives about dairy, let me do some more negatives before I switch to the positives, is it's a very highly allergenic food, especially, you know, how we've processed dairy in this country, you know, causes a lot of congestion, right? Cough, asthma, eczema, blowing your nose, you know, digestive issues. It's probably the food that we see that people react to the most, whether they react to the carbohydrate and they can't digest it and they get diarrhea or bloating, or they react to the protein and they get eczema or asthma. It's probably the most common food reaction food that we see. The positives about dairy, it's a wonderful source of protein. It is, you know, it's got all the different amino acids in it. For people who tolerate whey protein, it's probably one of the better protein powders if you're looking for a protein powder. You know, so there are some positives to it. I think that from a kid perspective, again, what we want to think about, and sometimes it's hard when you've had cancer yourself and you want to try to prevent something from happening, you know, but we, you know, we just want to be conscious of the fact that, you know, what we want to encourage is our young adults to make the best decisions 90% of the time, or even us make the best decisions 90% of the time. And, you know, there are times where we might not be making the best food choice, and have those educated, have those conversations that are educated, but try not to overreact, because when we overreact about a food, it often backfires. I don't know if that's helpful.
Yes, it is. Thank you. I mean, summer's coming up and there are lots of ice cream places. You know, it's
Yeah.
kind of like very difficult to, I could pull all that from myself and just have, you know, one bite of ice cream or no ice cream, but
Right.
not kids.
And the thing is, like, if you're going out for, let's say there's ice cream that's going to happen. People are going to eat
Yes.
some ice cream, right? Whole fat dairy ice cream actually will probably have a better impact on your blood sugar than, now I would choose sorbet because I can't eat dairy because I'm allergic to it. But like sorbet has no fat in it. So my blood sugar is going to shoot up a lot more than if you have whole fat dairy, you're going to have a slower blood sugar rise. So, you know, there are some benefits. When they took whole fat milk and they made it skim milk and then chocolate milk and chocolate skim milk in schools, that was not good because we just gave our kids more sugar, right?
Mm-hmm.
So it's really, there is a lot to be said about food and balance, and we've got to, you know, sometimes when we get rid of something, we overdo something else that wasn't always the better choice, right?
Yeah, I'm struggling with the food choices. Like the schools have all these free breakfasts. I mean, yikes! I mean, those muffins, the Lucky Charms,
the school breakfasts are awful. There's nothing good in there. I can't even find something good in school breakfast anymore.
Or even school lunch. But I have an 11-year-old, and of course she wants to be, you know, a kid.
Yeah.
So I'm trying to find that balance.
Yeah.
That's what I was wondering.
Yeah. Yeah, I know. Balance is tricky. Balance is tricky, but think about like really avoiding foods with added sugar. I think that's really, really, really important as much as possible. And so much of our food supply is added sugar, so it's not helpful.
Right.
Yeah.
Okay. Thank you.
Absolutely.
Great, Liz. I have another question, which is if you have genetic variants, like I did the nutrition genome genetic profile, and it suggested that I had issues with absorbing like plant or non-animal versions of like beta carotene or fish oils, and that I tended towards like a vitamin D deficiency. So at first I was supplementing a lot to sort of balance that. But I'm wondering, do I really need to be supplementing those things if I'm eating a, you know, really good, healthy diet?
Right. So what did one thing say about the genetic variations about beta carotene? Is that what you're saying?
Yeah, it said I needed to have like not like animal forms of beta carotene and also animal forms of fish oil.
Yeah.
And I tended, like I was a little deficient in vitamin D when I was diagnosed. So
Yeah.
I've been struggling with like, you know, at first I did supplement, and then I'm like, do I need to keep doing this? Like if I'm feeling healthier and I'm eating a, you know, a vibrant diet that's healthy.
So, you know, that I think this kind of falls into this category of the more we know, the less we know, right? So as we learn more and more and more about genetics, it's fascinating. And then we're like, okay, but now, and then we learn something new a little while later. But some of what you're talking about is they've been doing a lot of nutrigenomics, which is looking at what is the best diet for somebody. And so some of these panels are trying to come up with for this person, right? And we get this question a lot about vegan, vegetarian diets because you know, and especially in the cancer world, people get concerned about animal proteins and go, okay, can I switch to a vegan vegetarian diet, and will that be good for me? And the answer is it depends, because like if people have a variation in how well they can take their ground flaxseed, which is alpha linolenic acid, and convert that into EPA and DHA, and not everybody makes that conversion as easily, then they're going to become more readily become deficient in omega-3 fats. Okay. So fish oil, you know, I heard somebody say this the other day, and I thought it was a really good way to say it. The fish did the job for you. You know, they ate all that plant food and they turned it into EPA and DHA. So your body didn't have to do it. So if you, as a human, don't make that conversion as easily, then when you eat fish, you're going to have an easier time assimilating it. But everybody's different in how well they can assimilate it. Some people can take ground flaxseed and easily make omega-3 EPA and DHA. They never get dry eye. Their skin is beautiful. And then other people, if they're not eating animal sources of omega-3 fats, then they start to get all those signs and symptoms of omega-3 deficiency, which could include their hair gets dry, their skin gets dry eye. They might get bumps on the back of their arms. You know, they might feel, they might have some cognitive issues. You know, they may have more inflammation in their body. So, and then the same thing with beta carotene. That was another really good example you brought up. So beta carotene is in, it's in your carrots, your peppers, your, even in some spinach, but, you know, really, especially those yellow and orange foods, plant foods. So squashes, pumpkin, right? So beta carotene needs to get converted into retinol, which is vitamin A, right? Retinol in the body to be able to be utilized. And not everybody converts beta carotene into retinols easily. There's multiple reasons for that. One reason is genetics, but also if somebody's hypothyroid, for example, they might not make that conversion as easily. So there can be multiple reasons why that doesn't happen, but one being genetic. And so some people, like they might, when they don't make the conversion as easily, if they're eating a lot of beta carotene, they might see that the palms of their hands start to get orange. And they may then have signs about vitamin A deficiency, which means at night you don't see so well, or again, the bumps on the back of your arms, you might have more acne, your immune system might not work as well, right? So, so that is another thing that is like, okay, depends on the person, how well they can take beta carotene and make retinol. And so what we see with that question of, okay, can I be vegan, vegetarian, or is it not good for me? I find it really depends. There are some people that do it and do it beautifully and feel good and all is well. And then other people that can't, they don't feel well. We start to see nutritional deficiencies and they start to gain weight because they're just eating too many carbohydrates and they get more insulin resistant. And we know that's not good from a breast cancer perspective. So there, I think there's a wide variety of how people can do on those kind of diets, and it partly depends on genetics. So the question about supplementation, you know, I would rather us get everything from food. We do find that, you know, that there are some foods that are way easier to assimilate than others. So again, we go back to, like, if you're looking for your omega-3s, it's way easier for your body to absorb the omega-3s from your salmon than as we talked about with the walnuts and ground flaxseed, though you get good omega-3s that way. B12, you know, way easier to get your iron and B12 from your red meat than from, you know, plant foods. So and it depends on your digestion and all that sort of thing. So I mean, the question about should you supplement, it's very hard to get vitamin D in the Northeast for at least 6 months out of the year. So we often supplement with vitamin D. And I would say fish oil is something you know, omega-3 fats I supplement with a lot. Because even people who eat a lot of sardines and, you know, still are pretty often not getting optimal amounts.
Yeah. And do you think it's important to get a good amount of vitamin D? You know, I know that sometimes that's controversial because it's a hormone. Like,
so the question is, like, how much vitamin D do we need? And, you know, I mean, there is a lot of opinion on this. But I would say that you don't want to be deficient. We know that when you get your blood work done and you ask for a 25 hydroxy vitamin D, you do not want to be deficient in vitamin D. After that, there's a lot of opinion. I typically like, you know, a 25 hydroxy vitamin D to be about 50, you know, like, you know, anywhere from 40 to 70, I'm pretty happy. There are some concerns if it goes too high, you know, it could increase risk of kidney stones for some people. And then there are some some theoretical concerns that I think we don't have all figured out yet. But that's a lot of opinion. So if you're getting your blood work checked, you know, my optimal is somewhere between 40 and 70. But you know, there is a lot of opinion out there. And what do you need to take to get there? Depends on the person. For some people, it might be 1,000 or 2,000 IUs a day. For somebody else, it might be 5,000 IUs a day. I have people where it's 10,000 IUs a day. That's not very common, but it can happen. And when I give vitamin D, D3 as a supplement, I'm often giving it with K2 because K2 is really good for your immune system. And it's also great in terms of bone density. So, you know, it's a good way to get your D.
Yes, thank you so much. That was incredibly helpful. Betty Feldman asks, if you had your ovaries and fallopian tubes removed and immediately your skin starts to fall apart, ! How do you get enough omega-3 fats to improve your skin dryness, etc.? So I guess she's having some skin issues after this.
Right. Well, you know, so unfortunately, there's some things that cancer treatment or therapy or surgery makes it much harder for us, right? And so that, you know, there's certain things we, you know, they're not gonna give us back, right? So yes, absolutely right. When there is a precipitous drop or when there's a quick drop in hormones, that can definitely impact dryness in your hair and skin and cause changes. But it's also important to remember that nutrition plays a role, and you know, you can improve the you know, if you get enough. I'm going to go back to the protein, and I guess I don't want to be, you know, beating a dead horse, but what's fascinating about protein is, multiple ranges of women. 40% of women aren't getting sufficient protein in their diet. And that is really fascinating. And it really impacts our metabolism long term. And as I talked about, it impacts your functioning of your detoxification system. So, and it impacts your skin and your collagen and your hair. And, you know, so it is something to pay attention to, but you're right. You're right. Being low in a hormone, unfortunately, also has an impact as well. How many grams of protein per day? So in general, the easiest way to say it is 1 gram per kilo. So you take your weight, you divide it by 2.2, and that's the amount of kilos you are. An average woman, let's say, is 70 kilograms in body weight. So they need 70 grams of protein a day. There is some research and some research to show that as we get older, we need more. So you will hear some people talking about 1.5 grams per kilo. But I would say at a minimum, or like try to get in that 1 gram per kilo. That's like a good thing to really shoot for. And if you need 70, so that would be, let's say 70 grams, I'm just making that up, but maybe you want to go toward 90 or 100 grams, you take that protein, you divide it for each meal. You don't want to just load it in the evening, which so often people do. You want to have a good source at breakfast.
And do you consider legumes to be a protein?
Legumes are a protein. So beans and legumes are a good source of protein. The thing is, though, they're also have a lot of carbohydrates in them, right? So that for some people, depending on how much exercise they're doing and how much, that they might, there's only a certain, they can't get away. They could, if they overeat, they could be getting too much carbohydrates. So, but what I'd rather people do is take away the rice that they're having with their beans and still eat the beans, right? Like not have the bread, not have the pasta, not have the rice, and have those beans, because they're also a great source of fiber. But for some people, like too many legumes may cause digestive issues, or they might just cause, they will get, so a legume is part protein, part carbohydrate.
Gotcha. And Betty just had a follow-up, and I know we're running out of time here, so we'll start to wrap it up. But she just was wondering, in terms of for the skin, is there a way that you would suggest to up her omega-3 fats?
Yeah. So walnuts, great source of omega-3 fats as a nut source. And they're also really, anti-inflammatory, great for preventing heart disease. So I love raw walnuts. I keep mine in my freezer, throw it on my salad. Ground flaxseed, as we talked all about, really good source of omega-3 fats. But then your small fishes, because you want to avoid too many toxins from the environment. So, your sardines, canned salmon, even anchovies, your small high fat fishes are great sources of omega-3 fats. And then some people take omega-3 supplements.
Great. All right. Well, we're right here at 7:57, and so I guess this is probably time for us to wrap it up. Is there anything, Hope, you would like to say, or Liz, as we end the?
I just want to thank you for always being there for us, because you are, and we really appreciate it.
Well, thanks for having me, Hope, and it's great to be with you all.
Yes, this has been incredible. I really appreciate all the incredible information you've shared today.
Absolutely.
And yeah, if anyone has anything to say as we close out, feel free to open up your mics and say goodbye, and then we'll end the meeting just here shortly.
If anyone wants me to send them a calendar, just email me while I still have them.
All right. Well, I'm going to go ahead and close out. Good night,
all.
everybody.
Great being with you.
Thank you so much for attending.
Okay.